Last year in January, I found a very small, about the size of a eraser, tumor in my breast, and immediately within seconds of them putting the ultrasound machine on me, they immediately yelled down the hall to ask for a mammogram. 2 days later, they called me back in for a biopsy. And then 2 days after that, they called me to let me know that I had cancer, breast cancer. About a week later, I was in the doctor's office again, and that's when they let me know that I had triple negative breast cancer, which is a really extremely rare and aggressive form of breast cancer. I am so grateful right now because my kids, are 4 and 6, and this treatment is giving me hope. It's giving me hope that I'll get to see both of my kids lose their teeth. I'll get to see my daughter start preschool in a few weeks. I'll get to experience life moments that I haven't been sure that I've been able to be there for and experience.
She's a very special young lady, a big fighter. She has little children and she would like to survive.
I'm Bruce Allen. We, as a family, had a cancer journey with breast cancer with my wife Diane that we shared with Dr. Senecal, and I just wanted to share our story. At the time, we had just adopted Audrey, so she was about 4 months old, and our son was about 4 years old. And she was reading a book to my son one night and just felt something, on her breast. That little tiny lump had spread, and not only did it go to the first couple, every single lymph node on that side had cancer.
Diane was absolutely determined and motivated. Very positive lady, knew exactly why she was there. She was there because she wanted to watch her kids graduate from high school, that she wanted to enjoy that next Christmas, that she wanted to fight this cancer with every breath that she had. We began to understand that certain medications could block certain pathways that this kind of cancer used. Medications that were off the shelf that had been developed for other reasons were effective in blocking these pathways. So there was a series of options that we had as Diane fought this disease that became available to us, that thanks to research and to science took us down a path over a period of several years that proved to be quite effective.
I really believe coming back here and accessing all the things Dr. Senecal had access to, I believe it extended her life, years and years and years. Both kids have a lasting memory of their mom and were shaped by them really throughout the rest of their lives.
After testing my tumor, we found an immunotherapy that we knew would work for my tumor, however, it was not typically used for breast cancer. So that's when the CARE Foundation really stepped in and helped me get the drug that I needed that I wouldn't have been able to get. Each one of these drugs, each one of these treatments are so extremely expensive. And if it could save somebody's life, that's awesome, because a lot of people don't have that option, and then they gotta choose. Do you go under and not pay your bills so that you can afford a medication that may save your life? Or do you find something like this foundation that may be able to help you out of a hard spot?
That kind of system where we can actually access some of those off-label drugs that are proven to be safe and effective in other diseases that could be used in this case, that could actually make a difference in the patient care, is just amazing. CARE Foundation opens up a path for these patients to survive and go back to their normal lives. There is so much more work to do to cure cancer. Young people like Megan still have to survive to see their children to grow, and for that we need enormous amount of effort, energy, work, and of course to support all that resources.
Pushing forward with research for our community is where we're going to find more cures, is where we're going to see more moms with their kids, more grandmothers with their grandchildren, more dads being able to stay with their families. That's the key. Better research. We need your support in order to do that. And we're going to continue to make progress in that goal.
When we first got our 18 months to live talk from Dr. Senecal, on the way home, I said, Diane, we got to start talking bucket list. And so she did put together quite a list of things she'd like to see, much of which involved travel, even around the world. And I'd have to say, we pretty much got through that list. And of course, for me, it allowed, an extra 7, 8, 9 years with Diane.
I'm really hopeful that this will be an opportunity for me to get to experience many more family opportunities with them, and also just things that I want to do in life that I don't feel like I've completed yet, that I feel very hopeful of what's to come. I just want to say thank you. Thank you for saving my life. It's been a long battle, and I knew I was going to get emotional talking to you about it, but I'm just so grateful. My son just lost 2 teeth, and I wasn't sure that I was going to have an opportunity to see my kids lose their teeth, and it's small things like that every day that I'm just so incredibly grateful for your care and the amount of knowledge and the way that you study breast cancer is like nobody else I've ever seen or heard of, and I just want to say thank you.
We're going to continue in this journey together for a long, long time.
Yes, you're stuck with me.
I'm stuck with you, and you're stuck with me.
Deal.
Deal.